what we're finding is 90% of our patients are achieving almost 90% relief of their symptoms, which is unheard of. So can you straighten it?
Yeah.
Okay.
Dr. Ronald Lederman is an orthopedic surgeon. He runs a busy practice in this medical building just north of Detroit. With a staff of 25, the Lederman Center uses all the standard tools for pain relief and healing. And now it offers something new, cutting-edge MLS laser therapy. Dr. Lederman used it first on his own mother, who was suffering from debilitating pain.
I was in San Diego at our annual academy meeting when she called me. She called to tell me she had 2 treatments so far, and she went from a 9 out of 10 pain to 1 out of 10 pain. She told me that almost all of her pain was gone. So I immediately called the office and I said, "We're on."
The laser has been in constant use ever since, relieving pain and promoting healing.
This dual action, low energy light laser actually increases the mitochondrial activity of the cell. What that means is it creates a supercell which promotes healing. So now, not only are we offering this laser for patients to eliminate painful conditions, and some of these patients, by the way, have called us to cancel scheduled surgeries, but we're also offering it to patients who have had surgeries, and we're finding that they're healing faster. My best guesstimate is that we are seeing a 50% reduction in the healing time.
You start reading the science behind it and all the different outcome studies, and you say, gosh, this thing maybe works. And so we brought it into our clinic and we started seeing patient after patient responding with almost too good to be true. You see someone that has such debilitating pain and 1, 2 treatments and they're 80, 90% better. So it's been really miraculous.
One of those miracle patients is Tony Gamby, who endured severe ankle pain for 8 years.
After the first 7-minute treatment, I was completely without pain. I was smiling all day long because I hadn't walked without pain in a long time. And I can't wait to send other people in here to get the same benefits from it. I would spend the same amount or less on 6 treatments here than I would on a custom orthotic or any of the other devices that I've tried over the years to help me with the pain. And to be without pain like this, it's worth every penny.
These people are getting better. So in a sense, this has revolutionized my practice. Whereas I would have to say, throw up my hands and say, I'm sorry, there's nothing else I can offer you. We now have something to offer these patients. 90% of them are getting dramatically better.
MLS laser therapy is also improving this clinic's bottom line.
For the first time in 17 years, we are offering a treatment that is not covered by insurance. So you can imagine to offer a $500 or a $750 package of laser treatments to patients that's not covered by insurance really required a whole paradigm shift in this practice. And once we have realized the benefit of this cutting-edge laser technology, patients are now lining up for it. I don't know of any investment that pays for itself in a couple of months, but this looks to be one of them.
Price resistance has been almost non-existent. Another example is Penny Rao, who typically scored her foot pain at 9 out of 10 prior to MLS laser therapy.
Just being able to sleep, not having to take all the Motrin or a Vicodin or something to be able to sleep or just get through the day has really made a big difference. I think it's very reasonable for what it's done for me. The cost is like minimal.
If we can avoid a medication, have a laser treatment that's non-invasive, no side effects, very limited contraindications for patients that can't have the laser treatment, then why not try some? Why not try when the results that we've been getting are 90% plus?
Do you feel the difference?
Yes.
Every day I come to work, I feel like I have my ace in the hole. As we offer this to patients and as more and more patients sign up for it, we are getting more and more positive response from these patients, and it's changed the way we are practicing orthopedics.